I'm Christina Abuata. I'm a PROSE provider and a specialty contact lens fitter at Baylor College of Medicine in Houston, Texas. What drove me to fit specialty contact lenses was actually one of my externship sites that I did in optometry school. I was with a really great mentor who taught me the foundations of fitting scleral lenses, and during those appointments with the patients always would say, you know, you really need to do this. We never got the care that we needed and that we wanted, and we need more doctors like you. And I was still a student at the time, so I thought that maybe pursuing a residency or a fellowship and creating a stronger foundation would lead me to that path, and that's why I wanted to fit specialty contact lenses. I do fit both PROSE and scleral lenses, and the one main difference that I take into consideration when I'm doing a consult with patients is mainly their underlying condition. So if it is a chronic, progressive condition or somebody that I feel like just needs a little bit more time to fit, a little bit more hand-holding in the beginning, and maybe more customization, that's where I draw the line and I say that they're a PROSE candidate in that sense. If I have a patient who has a mild condition, maybe just a normal shaped eye, maybe some dryness, and just needs a little bit more comfort where we can get away with a scleral lens, I still think that that's a great option for them. And what I typically do is I would start the fitting with a scleral lens, see how they do. If we're having any reservations or any issues with the scleral lens, then that would lead me to wanting to switch them into a PROSE design, a little bit more customized, where we get a little bit more time as well to fit them. PROSE treatment would be very beneficial to patients with keratoconus, corneal transplants, dry eyes that is from Sjogren's syndrome or graft versus host disease, patients who have Stevens-Johnson syndrome, or even corneal scarring. We can also use it as a crutch for patients who have an eyelid droop, where their eye is droopy and also their nerve is damaged and they have muscle weakness, where we can actually prop up the eyelid and open the eyelid for them. So most of my patients who come to see me have almost tried everything. They've exhausted all options. Usually with our dry eye patients, we start them off with drops, gels, maybe some prescribed eye drops, steroids, bandage contact lens, punctal plugs. There are some cases where they've actually tried a scleral lens and they still were having issues with their comfort or with their vision. That's truly a daily thing that I see is we have a long list of previous therapies, and once we sort of get them into a PROSE device, slowly but surely we start knocking a little bit off of their therapies. We've had patients cry in the chair before because they were never able to see that well, and those patients really struck me and made me realize that I want to become better, and I want to help more and more patients who have different sorts of conditions like that. As a PROSE provider, I hope to continue to change lives. I feel like I've already made a really big impact for patients who have exhausted all options, and I hope to raise awareness about PROSE and to spread the word and make sure that more and more people are aware that we can help them. So my advice for other optometrists that want to become more successful with scleral lenses would be to find 1 or 2 scleral lens fitting sets that you want to master and really try to fit those lenses and understand the way that you should troubleshoot the lenses and how to design them for your patients. I would also recommend to use your consultants as much as you can and learn from them and understand their thought process in creating your lens for your patient so that you can learn how to troubleshoot.